One of the most requested cosmetic surgeries in the U.S. now is being used to treat lower back pain in women who have had children. And here to explain both the pros and cons is board-certified cosmetic surgeon Dr. Ralph Bashioum from the Bashioum Cosmetic Surgery Center in Wayzata. Thanks for joining us.
Oh, it's my pleasure.
This is an interesting topic, and we should point out that it's not just women who have had children that are looking for tummy tucks.
Not at all, because men who have had a lot of weight loss, maybe 100 pounds or so, they can experience the same problems with their muscles, which can help with balancing their back pain or back issues, and the extra skin that can hang down.
Let's talk about the procedure itself. What actually happens when you have a tummy tuck?
When you do a tummy tuck, the two parts of it are, one is to try to remove as much skin as you can to tighten the skin because it's been stretched either having a child or with weight loss. The other part is to tighten the muscles which have been stretched apart. So the two muscles that go up and down, the rectus muscles, get separated a little bit. We try to sew those back together. That narrows the waist and balances the muscle tension on the front of the abdomen with the back, so it helps reduce the back pain. Interesting, one of the newest advancements is we do it without drains. So all of the hassles associated with that have been eliminated now.
So the surgery is actually almost, is it outpatient? Or?
It's an outpatient surgery. We do it in our office.
Wow, that's fascinating.
It's very nice, and it's a very private situation where it's in an office setting.
Yeah. Well, let's talk about who's a good candidate, because this isn't a weight loss surgery. This is for someone who you would say is closer to their ideal weight already, right?
I like to see patients between 10 to 20 pounds of their ideal weight. And certainly we recommend the weight loss for medical conditions like reducing your risk of cancer, reducing your risk of osteoporosis of women with increased activity. All those things are important. So that's what we recommend. Women who have had children, many times will have a little extra skin and those muscles are stretched, their waist is a little bit wider. And then men who have certainly lost the weight, that's another group that really will seek out this surgery.
And I assume if you're a woman who's had children, you should wait until you're done having children before you would do this kind of thing. That's
right, because if you have another child, and it does happen, it kind of ruins the results. Right. And you can redo the surgery, but it's certainly it's more difficult when you do it a second time.
What advice would you give to people that if they're trying to decide whether this is right for them or not right now?
Well, I would say that if you're near the weight you want to be, 10 to 20 pounds to the weight you want to be, I think if you have problems with the skin hanging over when you sit down, or if your tummy sticks out, or if you have a little of the back pain associated that came on after having had children, this might be something to consider. It'd be a nice change for them.
So unless you're a supermodel, this is probably one of those things you might want to think about.
Supermodels show up as well. You know, they can have the same problems.
I bet they do.
That's right.
And one of the other things that you say is, especially for the moms, or only for the moms, I would assume, they often do a breast augmentation or a lift or something.
That's right. We can do additional surgeries. I don't recommend them together because I think that increases the risk of complications. The tummy tuck is a big surgery. We like to do that individually and then come back and do some other things if that bothers them. Remember, if you have one surgery, it's possible you may not want any more surgery because that'll fix the thing that really bothers you the most. You may not choose anything else, so don't take the extra risk unless you're certain.
That's good advice. Dr. Bashioum, thank you so much for being here. We really appreciate it.
Oh, you're welcome.
And we do have all this information and all this advice for you on our 4 p.m. show page. You can find that on KARE11.com. Still ahead.